these are basically the causes of the formation of the endometriosis. For you guys to know the name of these 6 things is more than enough, but in order for you to memorize it, I would like to explain you a little so that it's easy for you to memorize the words for all these 6 reasons, the causes. Basically, retrograde menstruation. Retrograde menstruation is when the menstrual blood, which has to flow out of your of your uterus, out of the pelvis, it does not flows out. As the word suggests, retrograde, it flows back. It flows back towards your, from your endometrium to your fallopian tube and towards the pelvic area. When it goes in the pelvic area, it may obviously it will carry along with itself the endometrial cells from the inner lining of the uterus, and therefore it will stick to the pelvic wall or any other area, and then it will form endometriosis. Okay, retrograde menstruation. Transformed peritoneal cells are basically that your peritoneal cells, cells which are present in your peritoneum, basically there are some hormones or basically the immune factors जो क्या करते हैं कि they convert your peritoneal cells into the cells which are like endometrial cells. So when they are converted into the endometrial cells, they will obviously form endometriosis, the endometrium tissue, and obviously lead to all the things that we have already talked about. Embryonic cell changes. Hormones such as estrogen may transform embryonic cell into the endometrial-like cells, and therefore endometriosis occurs. Surgical scar complication. Endometrial cell may attach to the scar tissue, which is basically whenever C-section occurs, there is a cut, right? So endometrial cells, if they attach to that scar tissue in later stage of life, they will form endometriosis. Endometrial cell transport. The blood vessels or tissue fluid system, they may move the endometrial cell to other part of the body. This is how endometriosis occurs. Immune system की conditions की वजह से they might occur endometriosis. Okay, now the last thing, the diagnosis and the treatment, and I'll just like to tell you that what is basically the staging of endometriosis. It is not that important, but for your exam point of view, you can see it. It's really easy. Basically, ASRM staging is based on the number of lesions, मतलब number of endometrial tissue lesions that are formed. Endometriosis that has occurred in the human body or in the pelvis. Second, on the depth of infiltration, मतलब कि the endometriosis that has already been occurred, उसकी depth कितनी अंदर तक गई है, इसकी stages के ऊपर हुआ है. The main thing that you have to remember is just these 4 stages. Anyone can ask you in your Viva or OSPE what are the 4 stages of is the staging criteria of endometriosis and what are the 4 stages. You should know that the staging criteria is ASRM staging. And the stages are stage 1, that is minimal, 2 mild, 3 moderate, and 4 severe. That's it. It's more than enough. Secondly, let's come towards the diagnosis. Diagnosis of endometriosis is normally done for people who have no symptoms if they undergo any surgery for any reason. So during that time, through laparoscopy, you can easily see that adhesions have been formed or endometrial tissue is present elsewhere in the pelvic region. So that discovery can happen. And the second thing is that diagnosis is done by laparoscopy. If the patient appears with all those symptoms that we have already discussed, then you do laparoscopy. Laparoscopy is basically a small cut is made in your abdomen and a camera is inserted, a small camera, and then you can see wherever the endometrial tissue is present, endometriosis is present or not. Okay. Now the treatment is easy. Why? Because first you will do the symptomatic treatment in the initial stage. Symptomatic treatment is if it is causing the central pelvic pain, you will give painkiller, you will give NSAIDs for the pain, and in order to control the endometrial tissue, what you will do is that you will use the birth control pills. Through hormonal treatment you can treat it. Then basic treatment is surgery for the later stages. Surgery involves removal or destruction of the endometriosis, the endometrial tissue. Wherever it is formed, you can either remove it or you can destroy it. And removal or destruction of the adhesions that have been formed, it will regain the fertility. Because of adhesion, infertility is caused. What will happen that as soon as you will remove or destroy the adhesions, the fallopian tube will open, the egg will come out and it will go fertilize with the sperm and fertilization will occur. So it will regain the fertility. Removal or drainage of the cyst. Cyst is basically the chocolate cyst we talked about on the ovary, which was present. So we can either remove it or drain it. It will also revive your fertility. hysterectomy is basically the removal of the uterus, and oophorectomy is basically the removal of the ovary. In these two are basically you have to do this treatment in very later stages where the endometriosis cannot be controlled. It is causing severe symptoms, and specifically oophorectomy will be a good treatment for the person who does not want to conceive in their later stages of life or things. So this is all, and our topic ends here. I hope you understood it well, and if there's any question you can ask me in the comment section. Thank you.